I am Dana Michelle Langford. I am a certified nurse midwife. I am also chair of our McDonald House Maternal and Infant Mortality Committee here at University Hospitals. My role is part clinical, part administrative. Clinically, I see patients for GYN, so gynecology. I also see patients for obstetrical care, so I see patients pre-pregnancy, during the pregnancy, during labor. I am there for your delivery and postpartum. I'm also a facilitator for the Centering program as well. Locally, preterm birth has affected us through our infant mortality rates. Nationally, the infant mortality rate is double for African Americans. So for every one white baby nationally that dies, 2 black babies die, which is astounding and heart-wrenching. But in Cuyahoga County, that number increases to 7-fold. So, and the number one reason in Cuyahoga County is preterm birth. So what we're finding out in Cuyahoga County is that Black women are more likely to go into preterm labor before 22 weeks. And why this is even more concerning and upsetting is because at 23 weeks is viability. So for whatever reason, our babies, and I say our because I'm included in that number as well, our babies aren't even getting to 23 weeks where we could do something to save them. Cuyahoga County, I think, is also very unique in the reasoning. They have factored in everything possible, including socioeconomic status. They factored in obesity. They factored in everything possible. And that number across lines, socioeconomic status lines, and everything continues to remain higher for Black women. And so the outcome has been institutional and structural racism in Cuyahoga County. A recent meeting I sat in said, it's an awesome place to have a baby if you're a white woman. It's the worst place to have a baby if you're a Black woman. So as a Black woman who has yet to even have her own child, to hear that and be sitting in a meeting, it's definitely something that needs to be worked on nationally, of course, but especially locally.